You're tuned in to RX Radio.
Like the Mel Gibson thing too, right?
I don't know that one, but I'm really excited because hold on, Lundy, are we recording?
Yeah.
You have the floor. So I'm really curious because did the injections give him anti-Semitism? Because it's like, I know people are worried about vaccines and autism, but I didn't know that. Please continue with that.
No, Mel Gibson was like that before. So Mel Gibson went on Joe Rogan's podcast talking about how himself or his dad specifically went to Panama for IV stem cells. So then because of that, IV stem cells became really popular. So in reality, IV stem cells are not a thing, mainly because you're not actually targeting a specific like pathology. You're just putting them throughout your body and hoping that they're going to work.
So when you say it's not a thing, now there's a few questions. First off, how recent was this Mel Gibson thing with IV stem cells?
Probably like 3 years ago, 4 years.
I would be remiss to meet the person who goes, health advice, I know this guy. He looks like Mel Gibson washed up on shore after being dead. That's what Mel Gibson currently looks like.
Well, regardless, it's Joe Rogan's influence.
Right.
I think
Dr.
anyone who
Oz
goes,
effect.
yeah, exactly. Oh God, Dr. Oz. Don't get me started on
Well,
that.
I think I might, right now that you've opened up the floor.
Oh man, that's a problem, right? In the general industry, the fitness and health industry, and regenerative medicine, unfortunately, is falling into the same camp of basically it's a popular people who aren't necessarily the most knowledgeable, but they do a good job marketing.
Right.
And so that's essentially what's happening. Is the best marketers. For example, and not to hit on chiropractors, but in the States, there's chiropractors who do stem cell injections, and they have no training in ultrasound guidance, no training in image guidance, not specialized in musculoskeletal medicine, like in terms of like interventional stuff. And they're not specialized in regenerative medicine, but then they're doing these treatments and they're actually out marketing MDs. I have colleagues of mine who are like, I'm getting out marketed by a chiropractor. No one's coming to me for my PRP injections. They're going to some chiropractor down the street.
Yeah.
So
yeah,
how do you compete with that, right?
Yeah, you get on a podcast.
Well, yeah, essentially,
that's the whole goal.
yeah, but that's the whole issue, right? It becomes who's the best at getting their voice out there.
Well, and this is where I've always this is far from where my technical capacities lie, but at least, I mean, because I saw that as like, oh, okay, there are stupid people in the fitness industry, there's stupid people in chiropractic, that if it is a popularity contest, like, all right, well, what are the tools that are going to help that? Yeah. Right. So, I mean, part of that has to fall back on the shoulders. And you're the only person I've ever seen on a podcast, other than mine, that talks about this.
Yeah.
Right? So what is it about your profession that stops people from getting out into the public? Are they all just that you guys were in school for so long, you don't know how to talk on a camera? Like, do the lights freak people out?
They don't teach us any. Chiropractors are taught business skills.
No, they're not. No, they're not. They're absolutely fucking not.
Are you sure?
I'll let you sit there and kind of like laugh with you, but they're absolutely fine. No, do you think anything around this I learned in chiropractic college?
I was told, I've been told that you guys get some training on like essentials of business or something like that.
Absolutely not.
Really?
Not
okay.
a single hour.
Okay, fine. All
right, we have it on the record.
Okay.
No, but like it's. I think it's more. You learn it as a secondary curriculum outside of the schooling because there's not a guaranteed job for you.
Right. And I think that's the biggest thing with the medical profession is basically like you just have to show up and you're going to get a job.
Right.
And so there's no incentive to really market yourself because you don't need to really. And that's the other thing too. There's a lot of doctors doing the regen stuff and they're making a decent living and they're happy doing what they're doing and they don't feel the need to push themselves to really, spread the message or whatever. So that's kind of that's why I like the whole social media thing so much. But.
Well, it's because my sister's like an MD, and I feel like the second med school students get accepted, it's like, and I have some friends who are professors with tenure. I feel like med school students are like tenure professors. They're like, I'm in, they ain't kicking me out now. My hand is stamped. I come and go in this forbidden city however I please.
Yeah, exactly. And that's the thing. I've worked with so many doctors who are just comfortable doing what they're doing and they don't want to really do anything more than that.
You know what? You should what if we cut physician salaries down to like the average annual chiropractic salary? You'd probably get pretty savvy in business.
Well, exactly.
Right? Like if you started an MD at $35,000 a year.
Yeah.
They'd be on podcasts. They'd be writing it in the sky with airplanes. Like,
well, that's how consultants are in the UK. They start at a lower base and then over time you build up. But Canada and US and even Australia, you essentially, even though I just freshly graduated, I could make as much as someone who's been working for 20 years.
Right.
Just as long as you see enough patients and you have the volume and whatever.
There's no incentive.
No.
So I mean, and that's always the thing. Like balls in your court, right? Because and it's funny. Our DMs back and forth are just you sending me dumb shit about like training and biomechanics, and I don't even know. And I basically come to know now, if it's not out of the Gallia clinic for the most part, other than a few clinicians you've connected me with in the States for some of the athletes that I work with, that if I don't know them by first name, the procedure is likely not 100% efficacious or 100% effective. And that's being generous.
Yeah, exactly. And that's the whole problem with the industry. There's so many exploitative people. They're happy to take people's money, but not necessarily give them the best, highest quality treatment. And that comes back to training too, right? Who's the guy who started PRP? Who's the guy who started Regen? It's Dr. Anthony Gallia, right? Yeah, so he's my mentor, and he's the one I trained with. And he did it back in 1996 for Dom and Billy. So he's like the pioneer of that stuff. And everyone kind of copycat him essentially. And there's just a lot of bad copycats out there.
Well, and because here's my thing, and I see it in the fitness industry, and the people who can sell it the most have the greatest belief in their system or method.
Yeah.
Right. So it's like I can sit there and bang my head against the wall and study this crap until I'm blue in the face, and then I could still wake up the next morning. Well, I have no idea what I'm doing.
Yeah.
Where I look on Instagram or whatever, and I just see someone just no shame, top of the mountaintop, yelling proclamations through the internet. It's like, oh no, this guy isn't Machiavellian in his approach. He's actually so stupid that he's 100% confident in his approach.
Yeah.
And like that must be the hard part for you, is like, because they're not smart enough to know that what they're doing isn't working. That's why they can sell it so well.
Yeah. You don't know what you don't know.
Right, but you know what they don't know, which is like the super
which is actually why I've been on social media, and I've helped people from UK and Australia, India. I've helped them, guide them in terms of who to see or what to do, because so many of them have got the wrong advice on this stuff.
All right, and let's play out a scene. What's the most common area of the body that you will use regenerative medicine therapies at?
Well, now for me, because I do spine, it's probably the spine.
Okay.
Look.
So I have low back injury.
Yeah.
Like let's say it's a disc. That would be a common one that you work with.
Yeah.
Okay. So let's say I'm in the States, but I can't come to Toronto, can't come see yourself. What's the policy? What's the checklist? Like I've had to do this for people with chiropractic. Like, okay, he's going to x-ray you on the first day, put your hand over your wallet, don't lose eye contact, walk out of the building. Right, that's like a thing that you'll do. Oh, they're on Groupon. You can buy clogs and fucking garden spades on Groupon. You don't want to buy someone who's going to be touching you. Red flag. What are your initial like exclusion criteria for diligent practitioners for people who want regenerative medicine?
First thing is look at their degree. So if they're
chiropractic college, run.
Chiropractic and naturopaths who do it, and unfortunately they're not specialized enough, so don't go to them. That's the first thing. Definitely exclude those. The second thing is you want someone who's doing image guidance. So there's actually a lot of people doing these injections unguided. Yeah, literally. It's like doing them blind. And there's research showing that even experienced orthopedic surgeons miss the target 90% of the time. Those are experienced surgeons.
Okay,
but without image guidance.
Okay.
Yeah, and that's without image guidance. So it's like what are you really accomplishing if you're not using image guidance, right? You're just guessing. So that's the other big thing to look for. And then ask them their expertise or experience with PRP, if they have different types of PRP, and if they have a scientist who actually measures their platelet counts. And that will literally narrow you down to probably 2 clinics in the US and 1 in Canada.
Really?
Yeah.
Okay, so let's walk through that last piece, because I think that's where most people are going to listen to this and kind of get a little bit confused. So PRP stands for what?
Platelet-rich plasma.
Okay, so you're saying exclusion criteria, you're in a clinic, they're talking about PRP, you're saying ask them for...
Yeah, see if they have a scientist who actually measures their platelet counts. That's probably the biggest thing to differentiate someone who knows what they're doing versus who doesn't. Because then they can actually tell you, okay, we can make different types of PRP formulations to target different pathology. Because not one size fits all.
Interesting. So a ligament versus a tendon versus a meniscus versus a vertebral disc will require differences in platelet density, concentration.
Yeah, exactly. Concentration and the way you process it. So for example, you can do something called filtration of the cells. So it's all so you take out any cells in there that might be pro-inflammatory, and it's purely anti-inflammatory, which is better for joints or arthritis.
That was the eye-opening thing for me. And I was probably like a lot of people listening when I first heard of PRP, and prior to going, like bringing some people in with and watching the procedure face to face, was I thought it was kind of like blood doping.
Yeah.
I thought it was kind of
like... They
like...
actually charged Tony for that. In 2008, he was charged in the US and he was put in a federal penitentiary in Buffalo for 1 day because they said he was blood doping these athletes.
Tony's hard as fuck, though.
Yeah,
Like Tony, wait, you know what Tony reminded me of in prison? Remember Cadbury from Richie Rich? That would be Tony in prison. Like he's probably got a guy on the inside there.
He said he made friends with the Latinos and like all the groups in there, and he had someone protecting him, so he's okay.
I get one phone call. Tony's probably the most well-connected person on the planet. Like, I met Tony through a very prominent figure I met him through you, but a very prominent figure in the NFL had an injury last season, and I happened to meet this player and his coach to kind of consult on the rehabilitation, and you were the first person that came to mind. And this player was like, no, I've already reached out to Dr. Gallia, and he doesn't have time. And this is like, I mean, we're talking 100 plus million career earnings, like household name, one of the best, I'm not going to name the position, ever to play the game. And it was only because like I'm friends with you that I could be like, don't worry, bro.
Yeah, basically he was on my schedule and then Tony saw him.
Yeah, I got you. But it's like, you know, that to me is what I always thought was like, oh, okay, like you take the blood out, because I learned this when that player came in. So there's like a morning procedure where a player comes in and you're just taking out blood, just straight.
Yeah.
Okay.
But the difference between that one, so the one we're talking about is called cyto-rich, which is a second generation one, because you're not just spinning the blood and injecting it back in, you're spinning it, but then you're actually incubating it and putting it through a little bit of a process that Dr. Gallia essentially invented. And that process increases the anti-inflammatory cytokines in the plasma. So what that means is it basically helps to target inflammation specifically. So for example, in arthritis, we know we get like increased IL, like interleukin receptor antagonists, and increased MMPs, which are pro-inflammatory cytokines. So the cyto-rich targets those better than the regular PRP.
Okay, so you enhance it with things that are going to attack pro-inflammatory markers?
Yeah.
Okay, so you have an injury and there's these markers that show up in the site of the injury that are just going to keep signaling for more localized inflammation.
Yeah.
Unless suppressed with the things that you enhance into and synthesize.
Because your body wants to fight, is trying to repair itself. But the problem is with cartilage injuries and a lot of chronic injuries, you just get chronic inflammation in the area. And if for whatever reason, it doesn't go away. And then you have this chronic pain or injury that just doesn't heal.
And that injury going chronic could large in part be due to the fact that we're not getting rid of or silencing that signaling process to keep calling inflammation in.
Yeah, exactly.
And then to spin someone's blood and just put it back in them without basically equating for that pro-inflammatory factor or to remove that signaling pathway is to really just dump more fuel on the fire.
Exactly. So PRP can make it. I had one patient who went to the States and they did this crazy 20 times increased PRP thing that I've never heard of. And they essentially came back and he was in severe pain for like a month. And I was like, I don't know what you had, but it wasn't like real PRP.
So how was it established, and this is like my own personal curiosity, the density or concentrations of platelets per specific tissue?
So that's based off the research. Basically, it's evolving, but we know now based off like tendon or muscle or joint, we can target the different platelet concentrations for those areas.
Okay, now is there a general rule like a muscle would have a greater blood supply? Let's say like does it fuck with bone? Like, do you guys work with bone?
Yeah, I started doing the intraosseous.
That's
I have a video. I was the first doctor in Canada to do that.
All I can imagine is that scene from The Incredible Hulk with Edward Norton where they're making the abomination and they put the big like 6-inch dart in the guy's spine.
Something like that.
Something like that. But it's like, and this is just my very rudimentary understanding of how this might work. Is there a sliding scale of platelet density that goes from avascular to vascular tissues? So if something has a good blood supply, is it going to be less of a platelet rich, like a muscle? Does it have less of a concentration than something like maybe a ligament or a bone?
Yeah. So generally speaking, we want to use, well, the concentration for joints and ligaments, we generally want 2 to 3 times, which is, the reason being is because it's less like inflammatory and it's less painful to inject as well. So there are more higher concentration ones, but we found that those ones are more pro-inflammatory, so we tend not to use those as much.
So the higher concentration would just have like a higher viscosity to it?
Yeah, it has increased VEGF and red blood cells. So there's easiest way to tell is like if the plasma you're getting is red versus like the golden one. So the red one tends to be more pro-inflammatory, whereas the golden one is more anti-inflammatory. That's like just a rudimentary way to tell.
Interesting.
So the red one we do use sometimes for like chronic muscle tears and stuff, because you do want, exactly. You want the cells, you want it to heal, and the cells act like a little scaffold as well. But for but then there's some, it's still evolving area. But I find, in my experience, I find the regular PRP without the red blood cells works just as well. And it's less painful as, for injection as well. When you inject like the thicker one, it just hurts like hell.
And that would be in a chronic muscle,
Yeah.
like a chronic muscle
Yeah.
tear.
Yeah.
Now, how would it have an effect? And this is something that I always have to battle with, is how does that stuff affect the scar tissue?
So yeah, scar tissue can definitely be a problem even after the injection, and you can get some scar tissue as the platelets and everything heal. That's why there's research showing that the 2 to 3 times increased one, or even PPP, which is platelet poor plasma, some people are starting to use that, which is even less platelet concentration, tends to lead to less scar tissue formation.
Okay, so if
Yeah.
you see someone that has like an affinity to lay down scar tissue post large injections,
Yeah,
you
they
know, we're
might
not
do
gonna come
PPP.
in-
You may do PPP. Yeah.
Right, so you're not
Yeah.
going to come in with like the Heinz ketchup bottle and
No,
start fucking
exactly,
putting
yeah.
that in, because that is going to leave.
Yeah, exactly. Yeah, and
Okay.
I've seen that before in shoulders, for example. People get frozen shoulder or bad scar tissue if they get like the red one done.
Okay.
Yeah.
So the big differentiating factor is, can they quantify the concentration of platelets that they're putting into the site? That's
Yeah.
going to be, if you can come up with a number, and how would that number be quantified?
So
Parts
it's usually
per million? Is it
like
millimoles per deciliter?
it's like 10 times to the 6, I guess. What was that?
10 to the power of 6?
Yeah.
Okay.
So whatever that is, but 2 to 3 times increase to 10 to the 6. Yes.
Okay, so it's 3 times normal.
Yeah.
Okay, so and now, is normal a predetermined value by a medical standard, or is it normal to that person? Like, does hematocrit level come into it?
Yeah, it can, because if you have someone who has a lot of hematocrit, then they're not going to have as much plasma. But you can still, it affects just how much plasma you can get, but it doesn't actually affect the platelet concentration or anything.
Okay.
Yeah.
So we're like blood doping, we'd be going for like, let's boost the let's take more red blood cells out of this and put it back in. Where you're like, let's take more plasma out and put it back in.
Yeah. Yeah.
Okay, because I think that's a misconception, is people probably think that you're taking the red blood cells
Yeah, no.
and putting those back in, like you're blood doping
Yeah.
the muscle, but
Yeah,
you're
yeah.
actually taking the other part of that. Like, let's say a hematocrit is 48%. You're taking that other 52%
Yeah.
of that is plasma, enriching that, synthesizing that, and then putting that back in.
Yeah, exactly. And guys who, for example, take anabolic steroids and stuff, we separate out their plasma, they have very little plasma and they have a lot of hematocrit.
Right, because they're just they're pumping maple syrup through their veins.
Essentially. So
Right, and that was really like, I always remember the story. Have you ever heard the name Bjorn Rees? So Bjorn Rees was a cyclist like pre-Lance days and pre like big, Lance getting outed by Oprah and all that bullshit, where he had a hematocrit of 60.
Oh, geez. Yeah.
Right, which is like, dude, how did you scale the Pyrenees
Yeah.
for like 30 days and not have a heart attack?
Yeah.
But yeah, so moving out from that, because there's PRP, the way you do it, what is the major difference between like the effective, calculated 2 to 3 times measured, monitored PRP and the ineffective or less effective ones? Like, what makes the other procedures that people are getting less effective or less than optimal?
They're just not tailored towards a specific condition. They're like a one size fits all. And that's the biggest thing, right? If you go to some PRP clinic and they're just like, they have like some generic centrifuge that they got from some manufacturer and they're just hoping it kind of works. But it's like drug companies, right? So now there's all these manufacturers that make their own centrifuges and then they sell them to doctors, just like drug reps come into clinics and sell drugs to doctors. Now there's all these PRP manufacturers that make all these centrifuges and sell them to doctors. But the problem is they're very like generic in the sense, because they're not like, you can't really customize them. There's just one formulation and then that's the one you're stuck with.
So what does that formulation usually turn out to be?
Usually it's the red blood cell one. That's what most of them are like that. They're like, some of them are like 8 to 9 times increased platelet concentration, which is way more than you'd actually need. And then there's more red blood cells and VEGF. So they're very targeting. I think that what they're marketing towards is more pro-inflammatory, which isn't actually where the new science is kind of going with that.
And if anything, based off what you're saying, that higher concentration, that higher density could actually leave in itself an injury behind with that muscle or with that tendon.
Yeah, exactly. It's not good. Yeah, exactly. Yeah,
because you just can't.
More
simply
irritating.
break
Yeah.
down. Okay,
Yeah.
so that's the big issue. So they might even use that as a marketing tool. Be like, well, Adeel is up there doing 2 to 3 times.
Yeah,
we're going in with the 10x. We're gonna 10x this guy.
And then that guy in the States was like, I'm doing 20x, and I was like, what? Like,
At that point, how do you administer that? Through like a hollowed out ballpoint pen? Like how do you pushing that through a syringe?
I have no idea. Like, it's crazy. That's what they told him. That patient I told you about with the back, he got 20x platelet
In the spine?
in the spine. Yeah.
And you might as well just fuse them.
It was so bad. He wasn't paying for a month after. It's just like ridiculous.
Interesting.
Yeah.
Okay, now how do you deal with like, and because there's one particular example in our DMs that was a lot of back and forth, and you wrote a really articulate post. The term TLDR, too long didn't read, came to mind. So I'm just gonna get you to explain it to me on the podcast. Rogan got his spine done.
Yeah.
What gives?
Yeah. So the way he had it done, first, I didn't really understand. Like, if you look at where the needles were, it almost looked like they just injected throughout, like just in the muscles and ligaments. There wasn't like a specific, it didn't look like there was a specific target. Like, for example, when we do the disc, we guide the needle directly with the X-ray, and it's just one needle that goes directly into the disc. He had like 10 needles. So first of all, I don't know what they were doing from that perspective. And another thing was he had something called orthokine, which is a good PRP product. It targets that interleukin receptor antagonist that we were talking about earlier, but it doesn't target the MMPs, which is the main difference between orthokine and cytorich. So
MMPs.
The matrix mallease proteinases.
Oh God. Man,
But they're basically a pro-inflammatory cytokine.
Okay, so they would be equally as important to the inflammation process to antagonize as something like an IL-6.
Exactly. Yeah.
Okay.
Yeah.
So you're really only going in with half the battle.
Exactly.
And now in that case, and I don't know the condition that led into it, but that seemed to me proactive rather than reactive. Like, it taught me up. Like going in there.
That's what it looked like to me, because it didn't. If you have a specific pathology, especially in the disc, like I don't see why you would why they would do the injections. Like, it almost looked like acupuncture they just did throughout his whole body.
Well, yeah, it kind of looked like they were going like a rector multifidus,
yeah, exactly,
maybe not into the actual level of like a facet joint, or maybe even into a specific multifidus that was atrophied, or scar tissue.
That's how we do our injections. Sometimes we see scar tissue or multifidus chronic tears, and then sometimes you can even see tears in the interspinous or supraspinous ligaments, and then facet joints, and then also the disc. It's very targeted therapy.
Right.
Yeah, it's not like just like, oh, let's just pepper it all around.
Yeah, just coming in with their sawed off shoddy full of.
It's the same principle. People always think more is better. They think 20x PRP is better. They think IV stem cells are better. They just think more and more and more. Like, it's just a weird. I think it's a human bias, or some sort of cognitive bias.
Yeah, I think it's born of a scarcity mindset, because not having any is terrible.
Yeah,
having no PRP when you need it is the worst. Trust me, I know. I tore my pec, I think, around the same time that Gallia was spending that day in prison, because I called Ben and I was like, "Yo, I need something. I need it bad," and I had none, and it sucked. And I was like, "Oh, if a guy on the side of the street could have been like 20 times," I'm like, "Well, I have 0 times PRP here, so 20 times PRP sounds pretty dope."
Yeah, exactly. I'll take it.
So, would that be something that you'd ever lay down in not a preventative setting, but like a blind setting like that? Like, where you're just going in. I'm assuming that procedure wasn't guided.
The one Joe Rogan had,
right.
From what I can tell, it didn't look like it was, because it looked like it was like you said, it was just superficial into the muscles, which you just kind of feel and palpate and just inject around. Which
is hilarious to me, because even from a chiropractor standpoint, the reproducibility of inter-examiner, or the inter-examiner reliability of palpatory landmarking next to MRI gold standard is hilariously off.
Is it? Yeah.
Like 3 to 4 segments. Like point to C7. Someone is pointing up here, which, I mean, this, if you don't know anatomy, that won't really mean much to you, but that is shockingly unreliable between individuals.
Yeah. Well, there you go. Right. So that's where it comes back to the gold standard of just use a camera when you do an injection. Like, come on.
Yeah. It doesn't seem like it's that, like, if you're going to spend the money to get the centrifuge, to pay for the marketing, it's like the diagnostic ultrasound. Maybe it's a write-off. You just write it off.
Literally.
Now, PRP, stem cell, peptides. What gives? Now, like, because you sound like PRP, cytokine-rich PRP, that's the way to go for most things. But when do stem cells enter into the conversation? When do peptides enter into the conversation?
Yeah, stem cells enter the conversation when you need a scaffold. So, for example, if you have a large rotator cuff tear, or if your pec tear was really large, and the PRP wouldn't be able to hold it, because if it's a high-grade tear and there's only a few fibers attached, you need something to hold it together.
Right.
So that's where the stem cells come in. So we can take your fat, we can take out what's called a stromovascular fraction, and that's where the adipose-derived stem cells are. And so that's essentially acts as a scaffold. And then we seed it with the PRP to regenerate the actual tendon or muscle.
Okay, so stem cells are really just going to lay down the structural foundation for which the PRP relies. So stem cells by themselves
aren't optimal without a scaffold. So you need a scaffold. Stem cells are not stem cells without a scaffold. It's the wrong word. They're called medicinal signaling cells. So when someone just takes your bone marrow and says they're injecting stem cells into your joint, those aren't actually stem cells. They're just signaling cells that reduce inflammation.
didn't Ben Greenfield like inject something into his dick? Lundy, can you look this up? Can you look put in Ben Greenfield stem cells? I'm really interested in this procedure because I've heard.
I think he did IV stem cells.
Oh, Moses, smell the roses. How the fuck how do you keep this straight?
It's frustrating because then people come to my clinic asking for IV stem cells and going to Panama.
Is he on there? Just command F penis and see if anything comes up. Okay. Why did something come up? Is there anything of note there?
He said that he's injecting them in the penis.
Okay.
Well,
I need your professional opinion. Like, I've done a podcast with Ben, and this is nowhere near the most obscure. Like, this is a guy who routinely puts coffee up his ass. So, stem cells into the old schlong there,
Yeah.
not outside his.
Well, there's something called the P shot.
Hold on, no, there's not.
Yes, it is.
What
It's
is this?
quite popular in the US, actually.
Explain.
So it's essentially
love this.
the PRP injection into the penis to increase blood flow and help harden erections.
I mean, just take a blue pill. Pop one, pop two, right? There's no fucking way. What's the gauge of the needle you're going at that with?
18. No,
Oh,
no, joking.
jeez. That's a catheter. Are you
Yeah.
joking me?
I think they obviously freeze it and stuff, but yeah.
They're going to have to stop you right there. No, thank you. There's no amount of fun that's worth that.
Well, Ben's always says he's like an N of one, right? He likes to experiment on himself, and there's nothing wrong with that. But obviously, he's a pretty popular health influencer, so
Right.
I think you just have to be careful not to get all your advice about stem cells from like Ben Greenfield. You know what I mean? Like
Or
he's not.
Joe Rogan.
And, yeah, exactly. They're not experts in that field, but they like to experiment. They bring people on, but it's important to get people who actually do this for a living.
And I think regardless, like Tim Ferriss is someone that you could pull into this. Dr. Oz had much more of like a meta effect on like the soccer mom demographic. Obviously Rogan's reach is so widespread, but it's like, I don't care what you think the outcome of this is. I care what the actual outcome of this is, right? Like the purpose of a system is what it does, not what you say it does. So if you just say that I'm experimenting on yourself, yeah, there's a lot of guys going the old P shot route ever since Ben Greenfield episode 293 is. So it's like, you got to own that as someone who puts stuff out into the space. And I feel like a lot of times, like whether it's a Rogan, whether it's a Greenfield, they don't assume that responsibility. Because if you really wanted to lay down disclaimers and your true purpose was to only experiment on yourself, then you'd shut the fuck up about it.
Yeah.
Right?
Yeah.
Because I think it just opens up a licensing. Like Malcolm Gladwell has this principle, and I think he sampled it from someone about like riot culture, where it's everyone has a number, right? Like to throw a brick. My grandma, if enough people were throwing bricks, it'd be hucking fucking bricks, right? I don't think, shout out Lundy, shout out Granny. Your granny's number is a lot less than mine. Granny's the first one throwing bricks. RIP. Shout out Granny. But it's like, it's the same with this. There's probably a lot of people with the number 2 next to their thought process around this procedure. And then if Ben Greenfield comes in as a widespread broadcast of being number 1, everyone goes, oh, okay, he did it. He's still alive, right into the main line, please and thank you. Where I feel that's such an irresponsible way. No matter how many disclaimers are laid down, it's like if you actually were worried about the health of people.
Yeah, you'd be like, I'm not an expert. This guy is. Check him out.
But just don't talk about it, right? Like literally stay in your lane. And like, just if you want to do it, fine. Or have, or just, it shouldn't be on your website. Like I get that you do it, but you can do stuff. And this is a crazy concept on the internet. You can do stuff and not talk about it and not post about it, which is such a novel idea. Now, so stem cells, good for larger tears, muscle.
Yeah, muscle, tendon, even cartilage defects, large cartilage defects.
Okay.
You can actually use like a mini scope, and you can, again, use that fat as a scaffold and then seed it with the PRP. because the PRP has growth factors in there.
Single procedure or two? You gotta lay the scaffolding down, let it
It's
set?
once, yeah. There's this new one-step procedure they're doing now in the States for that type of thing.
Really?
And the hot topic of research is like what type of scaffold is best. So you can use the stem cells as a scaffold, but there's also the other approach is to use HA, which is hyaluronic acid,
Right.
Which is like basically what makes up collagen and like the kind of like the gluey stuff in your knee that can act as a scaffold as well, and then you can see that with stem cells, and then that can regenerate tissue as well.
Is there a prevailing front runner between hyaluronic acid and stem cells?
Yeah, probably HA as a scaffold, and seeding them with stem cells is better than stem cells as a scaffold and seeding it with PRP.
Okay, now the stem cell thing, remember, it's early days. Like I was really young, at least maybe it was going on before that. It's just when I could actually start forming memories. But explain to me the ethical dilemma behind stem cells.
Yeah, so it's interesting actually. The FDA literally just a couple of weeks ago banned embryonic stem cells. So embryonic stem cells are like umbilical or amniotic stem cells, right?
And so that's in the States.
And that was in the States, and that was off the shelf amniotic stem cells that you could get. You could have gone down just a couple of weeks ago to the States for amniotic stem cells and got it off the shelf product and had it injected.
What was their reason as to why they were pulling it?
Because there's regulatory issues. Like basically it's like the wild, wild west. There's just people making all these amniotic and umbilical cord derived stem cell products, and there's like no oversight on what they're putting in there essentially.
Okay.
Like there was even one that was contaminated and caused like infections and like it was bad. So
Now, when like early days, the harvesting of those stem cells, is that, because doesn't it turn into like a pro-life thing?
well, yeah, embryonic stem cells does technically.
Okay.
But not if you're deriving autologous stem cells, if you're deriving them from your fat or bone marrow.
Now, is there a difference?
And fat is actually the best, most likely. Like if you're curious about which is the actual best source, fat seems to be the best.
So fat better than umbilical or amniotic.
Yeah, or bone. Yeah.
Right. So it's not like, I think people get in this idea that like these QAnon kids and like this Bill Clinton is out there drinking the adrenochrome out of like little kids. So like, oh, obviously like the fetal stuff is like the fountain of youth.
Yeah, exactly.
I think people get stuck on that
Yeah.
crazy narrative that like an umbilical or
Yeah, exactly. Literally, they want young blood.
is that what it is?
Yes.
Well, I mean, so that's like that. So there's not zero, but the scientific direction is headed more towards fat. What was the initial utility outside of, the fact that it was kind of creepy and weird and maybe had this fountain of youth? Oh, this cell could be anything. It could be a human or it could be Dave's meniscus. Like what was the science originally backing it?
They just thought it has a very potent anti-inflammatory effect. They kind of knew just like any mesenchymal stem cell does. So that's where I think the science kind of started from.
Okay, so now if we had to say that like anti-inflammatory effect of like the umbilical stem cell or like the the pro-life stem cell versus the anti-inflammatory effect of maybe a fat-derived stem cell with PRP, so fat-derived as a scaffold and PRP injection, how do these rank up next to one another?
There's no head-to-head studies, but based off like you were saying, the direction of the science and our clinical experience as well, definitely the fat with the PRP is better for regenerating like larger tears. Like in terms of arthritis, if you're trying to reduce inflammation, the amniotic stem cells are actually quite powerful as well.
Okay.
But the fat can be too. So, but then again, my preference would be not to inject fat into joints just because you're injecting, like there's actually cells in there, which can potentially lead to issues. If I was injecting a joint just for arthritis or inflammation, I would use like Cytorich, right?
Okay.
Because it's just pure anti-inflammatory.
Now, would that need something like it just into a joint? Let's say a knee, right? Something contained, interarticular, maybe it's like an ACL. Would you go hyaluronic acid at all?
Yeah, often we do actually. We do it after we do like a series of 3 injections, and then we'll do HA after like the last session.
Okay, so you would go in with maybe like a cytokine-rich PRP, rather than because that has the cytokine-rich PRP. For those of you following this, has those anti-inflammatory markers in there to decrease that signaling process. Where in the past we may have gone amniotic stem cell, because amniotic stem cell is known to be a very strong anti-inflammatory, but the PRP, we can control the dose based off the tissue, the concentration based off the tissue.
Amniotic is so early stage, and they banned it anyway, so it's a moot point now. So I don't know if they're going to be allowed again or what's going to happen with that. But
so there's no one out there in your community that's so pro the result of amniotic.
No, they're not like fighting for it. They're not, even all the top guys who in the States who I like, Dr. Sampson, he's one of the top guys. he completely agreed with the move by the FDA and everything too. So he uses the same thing. He uses the 2 to 3 time PRP and he uses fat a lot.
Okay.
And so that's kind of like the top guys, like they kind of know where the research is.
So it's kind of a silly argument. If someone's arguing for the utilization of,
because they want to make money, because they charge 20 grand for one of those injections,
and it's coming from the spawn of a human being.
And that's that marketing. Really? Yeah, I think it's that marketing.
Now I've heard about some crazy shit about IV stem cells in insane concentrations. And I've heard this from a few of my guys who've actually been sold on it. Like we're talking $75,000. I think it's in the UK.
Yeah.
Now, obviously, we've been talking localized injections in the regenerative setting, comparing, PRP just in a general sense, this over-the-counter centrifuge, bathtub brew shit, or, like the straight dope that's been scaled to the plasma count for specific tissue damages and sizes. Talked stem cells as far as like their utility in laying down scaffolding for larger injuries, which we can then use PRP on top of, or the cytokine rich PRP on top of. Now there's a prevailing market for mainlining it. Like just get the belt around the fucking shoulder and just put it right here.
Yeah.
What fucking gives there? Because like you're telling me that amniotic stem cells are not really, or they're good at anti-inflammatory, but not as good as maybe another combination of procedures that are available. And the stem cells
are safer potentially, right? And more well studied.
Right. And then you have the stem cells being really useful from a scaffolding standpoint to build up and house the PRP for larger, maybe muscle injuries. But then it's like they're just moving the goalpost with the stem cells. Now they're just putting it intravenous.
Your body. I think a lot of that came from popular media. Like I'm pretty sure Ben Grenfell had that done too. And then also obviously Mel Gibson, which we started the show off with. I
think that's what gave him the tism, the anti-Semitism.
Yeah, don't know where you got it from, but that's essentially the popular media is just that's where people get the idea from. They're like, oh, it worked for his dad, so it can work for me. But the reality is there's like so little studies on it, and we like do not know the systemic effects of IV stem cells throughout your whole body. Like how do the stem cells know where to go and what to do? Like when you inject them in local tissue, there's local cell signaling that goes on. So if I inject into your tendon has endogenous stem cells in them that get kind of almost awakened in a sense that when you inject those other like stem cells or PRP into there, that sends signals to start regenerating and bring in like the other guys to start regenerating.
Now that could mean like I heard that. And like I've talked to you and I pick your brain whenever I can. I've sat in on a few procedures and I heard about that going, well, that can't be good. Right? Like if it can do something really well locally, then just to let that loose in the system is like, you're saying, and I've seen it under guided diagnostic ultrasound going like, oh, no, we need to be very specific. Obviously very specific on the positive side so that we can affect the tissues that we need to affect. But I'm assuming part of this is like, we also need to keep this contained. Like it is it's like nuclear material. It's like, we can light up a whole city block with plutonium. Yeah. It's like, we don't really want 3 Mile Island here either, right?
Yeah, exactly. And that's the thing. I think I told you, I think we talked about this last time briefly, but there was a case report about one guy who had like IV stem cells in order to help his like eye, like to regenerate. And it actually like turned into bone, the tissue, instead of regenerating into like what they wanted.
Oh, hold on.
Yeah, there's a case report about that. It's not like I made it. That's actually
okay. So let's walk through this real quick. Ben Greenfield fan. I'm assuming, and by assuming I mean I totally making this up.
And the patient went blind, by the way. So yeah.
Oh yeah, the bone eye didn't fucking work. No shit. All right, so he goes, all right, I want you to just fill me up. Like an oil change on a Buick.
Yeah, I think he had some sort of macular degeneration, some sort of like, degeneration, is hoping the IV stem cells would regenerate the tissue.
Okay, so there was a pathology present.
Yeah.
All right, so he goes in and goes, I have a problem here. Could you stick the solution here? And then they go, absolutely.
Yeah.
And then the body goes, all right, we see your IV stem cells and we raise you an eye bone.
Yeah.
So his eyeball turned into a bone?
Yeah, like it was regenerated into bone. I don't.
And that's the thing. Like, don't let it off the chain.
Yeah.
Like, and this is maybe returning back to the original argument. Who was the guy who dove into the shallow end or some shit that was like sitting in the wheelchair? That was like a big advocate for early day stem cells. He played fucking Superman.
Oh, Christopher Reeves?
Christopher Reeves, right?
Yeah.
He was like an early advocate. Bloody, am I making this up?
I think he fell off a horse.
Whatever. I think, you know what it was? We've had a friend that jumped into the shallow end and maybe probably should have been paralyzed a few times. But that was the whole thing.
Yeah,
He was
well,
an
stem cells had so much promise, right? Because they were discovered around that early 90s time.
Right.
And there was so much excitement around this ability to regenerate new tissue. But then we realized it's way more complicated than just taking your fat or bone marrow and injecting it in and hoping it regrows new tissue, right? That's now we know it's about scaffolding and there's other, so that's really where the science is headed now.
Now, for you as a physician, that's scary to me, the bone eye thing.
Yeah, that's why I never encourage anyone to get IV stem cells. It's just it's too much in its infancy, and we just don't know the effects, how they're going to work in your body, right?
Because I mean, now is it something special to do with like ocular tissue and the super specialization of the eye? Like the eye is essentially the brain.
Yeah.
Especially looking at brain, you just don't really realize it.
Yeah.
Like if you pull an eye out, like the nerve that's attached to that thing
it's
it's quite lengthy. But could that be possible elsewhere, do you think? Like, could you have a heart bone? Obviously, we'd have some problems with a heart bone, but like, what is the signaling process that goes, we have all these specific, I don't know, endothelial cell, whatever the fuck in the eye, and go, you know what would look really good here?
Some bone.
A nice bone.
Some bone. Yeah, I don't exactly, and that's the thing. We don't understand the local mechanisms of IV stem cells and how they work. Whereas we do understand the mechanisms of like the specific local injections that we do,
Right.
And how that happens.
So at no point would you recommend IV stem cells?
No, stay away.
Okay, all right.
But
That's really
I
interesting.
do think in a couple years, as there's more research, I think exosomes potentially could be an area where like you could actually administer IV and help systemically and reduce inflammation and that kind of stuff.
Explain that one to me. Exosomes.
So exosomes are just like just imagine like a little packet of messenger cells, and they just like communicate between other cells.
Right.
And then they carry so you can have stem cells have exosomes in them,
Right.
and then you can use those what they're called mesenchymal stem cell exosomes, and you can actually derive those exosomes, and they have anti-inflammatory and messenger effects that can help with healing and pain and stuff. But it's still a very it's in infancy as well, I would say.
Okay.
But it shows a lot of promise in terms of like animal studies and everything.
Would the promise be in an intravenous setting, like in a systemic setting?
Potentially, because it could help something like MS or something like like autoimmune diseases, where it's like you have systemic inflammation and like that, those type of things.
So these exosome messenger cells, none of the messages that are being relayed are eye bone. That's not in the
No,
okay.
it seems like you can. It seems and nothing like that has been reported as far as I know.
How long ago was the eye bone thing?
That was 2 years ago.
Fucking terrifying.
Yeah.
And
I remember learning about, it was a podcast I was listening to about this doctor talking about the potential harms about stem cells, and he brought up that case.
Okay, so that right now is, it's one thing to go and get, the guy in Texas with the bullhorns on the front of his expedition going, we got 20 times.
Yeah.
The 20 times the platelets. Adeel up there up in Canada is doing the 2 times. So we are 10 times better than the Canadians. So it's that, like, that is, maybe it does, your buddy's spine hurts for like a month. And your body's like, all right, can we fucking get rid of this Heinz ketchup nonsense we got here? Whew, all right. And then maybe, there's probably residual scar tissue from having to deal with this localized influx of like a highly viscous material. But, there's no eye bone in that story.
Yeah.
So like if we had to rank order, like, all right, well, maybe the PRP, when not regulated by concentration and not maybe enriched with this cytokine to really knock out these inflammatory markers, it's not going to do you might not do you as good. It could actually do a little bit of harm, but you go to Panama, you get a vacation out of it. You lose 10 grand.
Yeah.
And you might be in the same place of where you started.
Yeah.
But so IV stem cells is going to be like, no, like this is a more serious conversation. Like you'd maybe be more adamant to talk someone out of that than.
Yeah. And I've talked many patients out of it, fortunately. They've listened to me. So, and in most cases, if they do want some sort of stem cell treatment, half the time they don't even need it because we can usually treat them with PRP.
Right.
And then if they do need something more aggressive, then a lot of times fat does a trick. And then and if that doesn't do a trick, then then the other option is to actually go to like, if there's parts of the States where they can culture the stem cells. They're not allowed to do in the States, but they send them like to the Caribbean,
Guam.
basically. Yeah,
Yeah.
literally. And then they culture them for 2 weeks and then they inject that. So if you culture them and grow them to a certain concentration, then that's the right way to do it.
Right. And that's true in the UK as well.
Yeah,
right?
exactly. Yeah.
I know
yeah.
a lot of guys will get their stuff shipped off to the UK.
Yeah, exactly. And they'll culture them. And
So interesting to me. Now, because here's kind of to circle back to our original conversation around like, yo, you guys are getting out marketed by dudes who snap necks and bank checks. Yo, my people are fucking up your people. But like you run into an issue, at least from where I'm sitting, as far as, you got my people coming in and just like buying a centrifuge at a garage sale and just YOLOing with the 18 gauge. But you also seem to be met with a lot of internal opposition from sort of just general medicine on a whole. Like, because your regenerative medicine to me is like a frontier specialization that might not be necessary, because we communicate well because we have to have more in-depth structure function conversations than most practitioners, right? Where when I start to talk to a doctor and I go just real basic, what I think to be basic anatomy, they're like, yeah, but 400 megs of acetaminophen and then they're good. It's like, oh my fucking God.
Yeah.
But you have the same battle internally with medicine, because they see you not more like a me, but it's like, we have a way of doing things, young buck, we'll sit aside here and you let us do this.
We're kind of the dark sheep of we're dark horse. No, dark sheep of medicine.
Horse sounds cooler. I would say dark horse, because that's like a dark sheep's black sheep. Black sheep, nailed it. Dark horse, black sheep.
Yes, that's the one.
Fact check it. Lundy doing Lundy things over there.
Thanks. Yeah, no, but seriously, family doctors, like I've had family doctors who even refuse to refer to me after a patient begged them because they found about me online and they're like, oh, I really think PRP could help me. And then they'll be like, my doctor refuses to refer to you. And I'm like, that is a shame. And when the doctor knows literally nothing about it, there's no education in med school about this stuff, obviously. And they haven't done any extra training in this, but for whatever reason, they think it doesn't work. So they don't want to refer. And it's just, so there's a lot of opposition, but it's the whole medical industry, right? It's just drugs and surgery. Everything else is just considered like, you're a quack almost.
Which is crazy to me, because like if I were to ever to pretend to be someone else from like a rap sheet standpoint, it would be you. Like for just like, I don't know if any of you guys are interested in Adeel's like record or where he studied and what he's done, just go to our last podcast that we recorded. But it's like the ultimate medical flex.
No, it's
well, no, like fuck you. I'm not gonna we're gonna edit out the part where he said no, just to not allow him to be, have an ounce of humility. But it's like, that's gotta be so frustrating. Because I get frustrated. I'm a fucking chiropractor that talks on the internet. Like, let's be serious. And I get frustrated when I talk to contemporaries, and I use the word generously, like contemporaries in the chiropractic field, where I'm like, look, man, me and you, like, we're just different. Or even worse, like in the training business or education business, where like some guys like, yeah, I really like personal training. So I was a manager at a big box gym, and now I teach people about personal training. It's like, we might just be a little bit like, I don't think you have, and I'm arrogant as fuck sometimes, especially around shit that I care about. So I'm like, I'll just like, oh no, like we're not having this conversation. Like you need to have, like, I want to see a GPA. I want to see athletes you've worked with. Until you fucking show me your name tag on your 24-hour fitness store, I don't give a fuck. Like that doesn't enter you into the conversation. And this isn't part of my business that I don't want to say doesn't matter, but is not nearly to the level that you've ascended to in regenerative medicine. It must be so frustrating. I would burn people's offices down. It's like, well, my MD told me that. It's like, your MD has an Etch-a-Sketch in the fucking waiting room. Literally. Fuck this guy.
Yeah. And like they don't realize, like, I mean, like you were saying earlier, our clinic, we literally treat the top people in the world. Like you name whoever, and they probably come to us, and like not just Toronto, but around the world. And there's a reason for that. So it's not like we're not here to brag, but it's just like other family doctors have no idea about that stuff.
Right. Well, you guys are literally like a secret society. Yeah. Like if I was ever done up in like a really bad way, if I was ever like, I don't know, in a prison somewhere, like if I had to sit in front of Congress to like be tried for something, I wouldn't throw up a gang sign or like, what is it, like stone hammer or one of these fucking things. I would just be like, Adeel Khan, Tony Gallia. Come with us, sir. Come with us into this room and be like, who do you know? How do you know those names? And it's like, yeah, it is really the who's who. So it's so hard to like see people sit there and demonize, like, especially you. Like, I'll get called a quack. I'm like, yeah, whatever. But anything else? Like, I don't know where my chiropractic school diploma is.
Yeah, exactly.
I have no idea.
Yeah.
I think it might be in California. It might be in my parents' basement. It might be in the trunk of a car I used to own. Don't even know where that car is anymore. But like to hear someone call like what you guys do a quack and to see like one of the most prolific NFL players of all time, go in a single day from the private jet, pick him up on the tarmac, bring him into your clinic. What up, Adeel? This is blank. Okay, we're gonna pull it out, and then here's someone who flew in from somewhere in a day.
Yeah.
And I mean, if anyone's ever looked into what it costs to charter a private jet, it's about, I don't know, $4,000 or $5,000 an hour.
Yeah.
He was a 5-hour flight away, round trip, because he left at 10 o'clock that night. Plus the cost of the procedure for that athlete for his injury. It's like, they're not doing this. No one's taking the PJ to Panama.
Yeah.
Right? No one's going down to Texas for taking the private jet into the Yankee guy doing 20 times PRP.
Yeah, exactly. But that's the part of the thing. It's like we talked about anonymity, right? We don't advertise that stuff, but that's maybe our fault too for not being as vocal about that stuff. But
I think that's the luxury brand though.
Yeah.
Right? Like I remember when I moved to California, and this is going to shows you how broke I grew up, that I was behind a Tesla. And I know you're a big Tesla fan. And I had to look, it was like one of the old Roadsters, and I had to look it up. I'm like, what is this car before? I had never seen this car before. So I had to Google search Tesla. I was like, oh, it's a car company. It's electric? No way. Right. But like that was part of the allure. Like those who need to know.
Yeah.
And I think to a certain degree, and obviously it's nice in the GTA when, anyone could have access to this service. But I think that's going to be the calling card that starts to pull people into the better science and the better practice is like, look, this is the type of person you can attract. Like those in the know this. Like you're like a fancy watch.
That's a good way to look
in
at
a way.
it.
And I have friends who have fancy watches, and I kind of see it now. Like it's a signal.
Yeah.
Right. Where it's like, I think if people can signal that level of professionalism, that level of dedication, that level of treatment, of attention to detail, it's like, oh, this is actually the best marketing tool.
Yeah.
Right. Like I think to put yourself on a bus.
Yeah, exactly. It devalues you for sure. Yeah. But the irony of all this is I get so many patients from other trainers and chiros and physios and stuff like that, as opposed to other doctors. So that's because other doctors just don't know much about it. Whereas I find a lot of therapists and trainers are willing to learn about it, and they're willing to, they follow, social media or whatever, and they're actually willing to investigate it. Whereas a lot of doctors are just like, oh, that doesn't work.
Right. Well, I think the interesting thing is you couldn't handle anymore. It's
crazy.
8 o'clock at night.
I know it's crazy.
It's the only time we can make this happen. So I think it's your people that got to figure it out.
Yeah.
Right. Like there has to be a more concentrated effort from the conventional medical community, because chiros look at it and go, wait, I can make money. Oh, tremendous. Yes. I'll have one centrifuge, please. And we'll 20X that. Here you go. There's a jab for you, for you. Everyone gets a jab. Where it's like the medical community. And maybe that's partially our fault because we've sullied the product and they just hear about, I got PRP done, not knowing it's from a chiropractor. But I think you guys have like a huge opportunity, because in 10 years, 15 years, like I think, and I could be wrong, but since I've started hearing about it like 20, 30 years ago, early 90s, it has made considerable strides.
Yeah, it's like exponential. The trend is just going towards that. And especially now with COVID and stuff and all the delays in surgeries, it's like, it's crazy.
Oh, yeah, interesting. I never considered that.
There's like hundreds of thousands of surgeries that have been canceled or delayed. And then people are like, what do I do? And they search online, and then a lot of times they end up seeing us.
Well, that's a net benefit, I think.
Yeah, no, and patients are so happy. They're like, oh, how come no one ever told me about this? I never heard about this. This is amazing. Like, what I mean, I don't have to get surgery. Like, because there's so many like partial tears or whatever that people get surgery for, right? And they don't realize that.
And it's much more cost effective. Like you don't.
Yeah, on the system, on the patient, less time off work, all that stuff. Yeah.
And it's sad. I mean, it's the same as anything that gets pioneered, right? Like there's very few people that are taking like extreme amounts of risk. Like if you told me like, hey man, you got to go work, but there's a chance you might end up in a federal penitentiary. I'm like, nah, I'm good. I'm good. Like I'll stay up here in Toronto. Like I'm not going to take that risk. But for like what you guys are doing and to like pioneer it to take that risk, and because at the end of the day, it's really just better outcomes, right? Like that's what you guys are after.
Yeah, exactly.
Like you guys are the most low key clinic. Like your Tesla drives you in, which is like yeah, everyone's got those now. But it's like it's a very unassuming facility. Not unassuming in the sense, I mean, it is state of the art with the technology you guys have. But it's like if you parked yourself, and don't do this, But if someone did like TMZ park themselves outside of your clinic, like I'm sure the convenience store next door, it's like, what the fuck is going on next? Like it's like Bohemian Grove over there. It's like I got every celebrity in the world coming through.
Well, that's
there.
the thing. You'd be surprised who you see. Yeah. People sometimes see some of the people who walk by and they're like, was that, wait, isn't that the guy from the Leafs?
Yeah.
Or whatever, that celebrity or whatever. Yeah.
Right.
So,
that movie, that president of that country. Yeah. I mean, and that's where these things start, right?
Yeah.
Like I remember big screen TVs when I was a kid would take up half this room and they cost $30,000. And now it's like, we got technically a big screen TV there, and I don't know what that costs, but it's definitely not 10 grand. It doesn't take up half the room, right? So I think you guys are out like fighting the good fight as far as the regenerative medicine stuff and really like pushing medicine forward in general.
Yeah, no, it's a trend, right? Patients want to avoid surgery, and actually, especially millennials and Generation Z, they're even more anti-drug, and which is actually a good thing, I think, in long term. As annoying as their other stuff is, but
yeah, I'm glad you're not including me in that, because I don't know if I don't think I'm a millennial. I think I know.
Yeah, you're a millennial.
No.
What do you mean no?
No, because I think millennials a state of mind.
Okay.
I saw a 65-year-old man wearing like trendy New Balance shoes and skinny jeans in business class and SFO ask for a flight attendant to take his bag down. That man, albeit 65, millennial. That's a millennial move.
Was he eating avocado toast?
He could have been. It is San Francisco. San Francisco is the city for millennials. But no, it's been cool to be able to sit like literally bedside and see this stuff, and it's pretty wild. And like I'm following the player that we brought in, and this ACL was week 9. The procedure was done in December, and now he's 22, 23 miles per hour flat out sprinting. And to see people who have had ACLs tears in the past at that level, it ruined their career.
Yeah, exactly.
Right?
Yeah.
Like that's a no
They're like,
joke
and then some people were saying he's not going to come back either.
Yeah. Well, and that's it. And to me that, and like you said, I wish, and maybe we can get him on the podcast one day and like have him, because I know he's seen you guys a few times.
Yeah.
Just to kind of have him share his experience, because I think because there's so much money on the line, right? The anonymity, we can't say who it is, but like trust me when I say it's someone that you would definitely know. But to see the outcomes of that, and not in like, oh, look at his passive range of motion. Oh yes, tremendous. Tony, what do you think? Passive range of motion. It's like guys running 23 miles an hour. Are you joking me?
Yeah.
There are people that Lundy, Jason Gander tore his ACL when we were in the 10th grade. He's still limping around. I can guarantee it. Still limping around 15 years later. So like this is like no joke stuff. And like when the structure and the function kind of come together, obviously he works with a good team. I'm not going to name any more than that, so to give him away. But it's crazy to see the outcomes. It's crazy to think that we're still just knocking on the door. Yeah,
exactly. Yeah. And then just about your other point about the peptides, like, so peptides, they recently just banned 2 at the FDA.
God, the government, but psilocybin, you can do heroin in Oregon now. But I can't jab some BPC 157.
Yeah, literally. So any doctor who's advertising that will have FDA like basically breathing down their necks.
How recently is this? Because
within a couple of weeks. Yeah,
it was where I saw it?
Where?
In Florida.
Yeah, so that doctor can get in trouble, and he could actually get like suspended.
Okay.
It's like a United States policy now. So
do you see that as a potential frontier, or do you think?
I was excited about it. It's kind of a shame. I don't. It's the same thing, right? Like it's like there's no regulation, so then people are just doing all sorts of stuff. It doesn't mean you ban it completely. You put some oversight, but you don't necessarily have to ban it, right? And so that's the problem with this like approach. It's just like, oh, we don't know what's going on, so we're just going to stop everyone from doing it.
Right.
So
now, with what you've seen leading up till now, and this like what we currently have in place with like the integration of stem cell scaffolding and larger muscle tears, and sort of laying this PRP in this foundation. And then plus the emergence of second generation cytokine rich PRP. How did, maybe is a better question, your excitement or your promise or your optimism around peptides, how did that rank with the rest of the procedures that we can currently do?
Yeah, I'd say it's just an adjunctive thing. Like it may just accelerate the process of recovery. Like for example, with the ACL or whatever, maybe if we did peptides with it, maybe it could shorten it by a couple of weeks or something. Okay. Which could make a difference for someone like at that level.
Sure. And do we think based off of like historical precedents of, deregulating and then regulating and then deregulating these drugs, that we'll see peptides emerge as like a contender in the regenerative?
Eventually, I think it'll be back, because there's definitely research on it with regenerative, with PRP and peptides working synergistically together.
Right.
There's only really one Dr. William Seeds in the States.
Hey, Doc Seeds, the man with the greatest bow tie collection. The only grown man I've ever respected that wore a bow tie. He looked like Tucker Carlson every time I see him. He's just got like this. He's jacked as fuck. Can we talk about that?
Well, I think he's
we're going to have Seeds on the podcast. I'm going to reach out to Seeds, but he's the head of the International Peptide Society.
Oh, yeah. So he'd be the perfect guy to talk to.
Yeah. He worked with like Dancing with the Stars.
But that's what he's kind of known for, right? People go to him for peptides, and then he dabbles a bit in the regen space too.
It's amazing.
Yeah.
He's like he looks like a jacked Will Ferrell. He's my favorite. he's my favorite cartoon character. Like the guy's out of control. But no, I think it's cool to get clear of the air because it's something that I get asked about a lot, and especially in the pro athlete setting where it's like, hey, what do you think of this? And I've basically been told by you in short, like Cole's Notes version, like, look, if it's not in Toronto or from, what was her name?
Beverly Hills, Dr. Sampson.
Sampson, right.
Yeah.
If it's not, Gallia, you or Sampson, like it's probably not taken this level deep in thought process and in application. But it's cool to get some insight and hopefully some takeaways as far as like how people can start to navigate the space. Because this bullshit, the old P shot, up the main vein, whatever the fuck, Ben, and shout out Ben Greenfield for just willing to take it there. Like, I love this It's my favorite thing. It's connecting me with the coolest people, Ben including.
Just so people know, it says injecting stem cells into all major parts, including face, scalp, and penis.
Okay, it's like, I think he's kind of stroking himself a little bit. Like, all major parts. My femur is a major part of my body. Right. At no point does the hammer start to go like, all right, well, we're vying for that number one spot next to femur. That's a little auspicious, I think. That's but I mean, a guy who's willing to take it there. I'm not willing to take it there. If you come at me with a needle to the horn, like, fuck yourself. Scalp and penis. That timestamp. Can we get an episode on that? I might even just, if you guys want to compare and contrast. This is episode. What episode? The single most comprehensive stem cell procedure known to humankind, not even mankind. He got on the gender pronoun thing. What a loser. How a full body stem cell and exosome makeover works.
Well, this is anti-aging and cosmetics, right?
Do we know this guy? Do you know any of these people?
No.
And if you don't know them, they don't exist, right?
I'm sure they're just cosmetic people who are exploiting.
Can we see what their credentials are? Like, can we see if they're because they're just saying Dr. So-and-so, Dr. So-and-so, right? Like, is there anywhere? I
feel like they're probably MDs, which would be more embarrassing, but unfortunately.
Well, embarrassing for you. That's a win. That's a win for me.
ND. Oh, no. Neither of us.
Oh, man, that's worse. A naturopath. They're like, yo, as much as I'm not a real doctor, they're definitely, because didn't like, it was naturopath? Yeah, that's total bullshit, right? I mean, I'll say it. Fuck it. You're a professional. I'll say whatever the fuck I want. Is the other one, wait for it, MD. She's the MD.
Well,
interesting.
MD and an ND.
Yikes. That's going to be a no for me, dog.
Yeah, so she's specializing in aesthetics and sexual medicine.
Sexual medicine. Fuck, now I've heard everything. Well, if you have to see a deal, make sure you slide in the DM with the old sexual medicine inquiry.
I do not do pee shots, for the record.
I feel like that's going to be, or if someone could expose the weird foot fetish market and regenerative medicine, I feel like that's the next real creepy frontier. Is like, can you make my feet age less? It's funny, people message Tess about pictures of her feet, and I'll just send her pictures of mine, which is like, maybe that might even be worse. But yeah, for those of you looking to slide in the DM for the sexual medicine pee shot therapy, where do people find you on Instagram? Well, I mean, I know where to find you. I know where you fucking live now.
Yeah, basically at dr.acon. So pretty simple.
Dr. Akon, aka Convict Music. I play Akon in my head every single time I can. Yeah. I literally have him saved in my phone as Dr. Convict Music. Yeah. Akon. Akon's doing a lot of good in the world. Did you know that? He's a humanitarian. Akon's donated.
He's not in jail anymore?
No, dude. He's like building churches in Africa. He's like donated like $300 million.
Wow.
He's out there making a difference. Like you.
He's a real Akon.
He's a real Akon. Dr. Akon, thanks for coming on, man. We'll have to do this again sometime.
Yeah,
I want to get a round table. Maybe we get Seeds in here, get some of the local boys, get Maddie in here.
That'd be
Andy O'Brien.
It'd be so fun.
You're just going to be a guest host.
Yeah.
Awesome. You got nothing else to do.
I live nearby.
Right. All right. Well, thanks so much, man. Appreciate it.
All right, cool.